That's a minute in. Hello, everybody. Thank you so much for joining us today. My name is Katrina. I'm the coordinator for the APPG for Entrepreneurship. And today we're partnering with the APPG for Disability. APPG groups are designed to help keep parliamentarians informed about things that are happening outside of the Whitehall environment, raise awareness, in our case, of entrepreneur needs and disability groups. So we're really pleased to have this opportunity to talk about this with some experts in the field. I will just introduce our speakers and then explain how we're going to field questions. One thing I should probably mention, and will also write into the chat, is unfortunately for this event we don't have any live subtitles, but we are taking a recording of the event and we will add subtitles to that recording and make that available after this meeting. So apologies to anyone who was hoping to be able to read along at the same time, and we'll make sure that is accessible afterwards. So we're very lucky today to have three fantastic speakers. We are joined by Lisa Cameron MP, who is the MP for East Kilbride, Strathaven and Lesmahagow. I hope I pronounced that all right. And is the SNP Shadow Spokesperson for Mental Health and the chair of the APPG for Disability. So hello, Lisa, and thank you very much for joining us. We are also joined by two experts, Liz Johnson, who is a Paralympian gold medal winner and co-founder of the Ability Group. And they've just today launched a brand new platform called Podium, which supports people with independent working. So Liz can tell us a bit more about that within this webinar. And we're also joined by Kush Kanodia, social entrepreneur and ambassador for Disability Rights UK. And among many other things, Kush is currently working with an organisation called Kaleidoscope, which is offering investment and training and support to disabled entrepreneurs. So thank you very much for joining us as well, Kush. Questions today will be fielded by Philip Salter, who is the MD and founder of the Entrepreneurs Network, which is also the Secretariat for the APPG for Entrepreneurship. And we've got some pre-submitted questions, so thank you very much to anyone who sent those in. But we'll also be accepting new questions through the chat. So if you have a question during the meeting, what would be very helpful is if you could write who that question is directed to at the beginning of your comment, and then put the question out. And I will be watching, looking for some really great questions, and I'll let you know that we're going to come to you and unmute you when your opportunity arises. So if anyone has any questions for me, write them in the chat, and I'm now going to hand over to our opening speaker, which is MP Lisa Cameron. Go ahead, Lisa.
Hi everybody. Thank you so much for coming to this excellent event today. I just want to thank the All-Party Parliamentary Group for Entrepreneurship and the APPG for Disability that I chair for bringing this together. I think it is such an important issue now in so many ways. As chair of the APPG Disability, it's something that I feel very passionately about. And that I have really been trying to champion since becoming chair of the group 5 years ago with government. When I started, disability issues were held at that point within the Department for Work and Pensions, and I felt at that stage that that was such a blinkered approach to looking at the skills and contribution of people with disabilities right across the United Kingdom, that it was one of the issues that every time somebody came to me to speak about anything, it was always about benefits. And I said, well, for goodness sake, we can't possibly be leaving such a massive part of the population behind, be thinking about them in terms of benefits when there are so many skills, abilities and contributions that can be made in so many ways right across the spectrum. And we must also think about enabling and supporting and championing and actually learning from those people who have disabilities who are also entrepreneurs, who are not employees but who are employers, and be making sure that the message is that the work that they're doing creates jobs, and they can mentor people, bring them through, and we really want to harness this potential right across the United Kingdom. I think it is such an important message to give, but also opportunity to give to people, so that everyone who has the potential can maximise their skills in the United Kingdom today. So I'm pleased that disability now sits at the Cabinet Office and right across all of the departments. I spoke last week with the advisor to the Prime Minister on disability and raised this very issue today. So they're aware as well of today's meeting, and they're aware that there are people who are doing fantastic work right across the spectrum in the country in terms of supporting the efforts during the pandemic and beyond. We're going to be in a difficult economic situation following from the pandemic, and what I want to make sure is that the supports which should be there for everybody equally in society to have that dream of starting their own business, to have that support to have their own business, to develop their ideas and make that work, that we continue to provide that. And I think there's tremendous cross-party support for those ideals in our society, and through policy we have to ensure that that happens. So I'm here to hear the inspirational accounts from people who will be contributing today, and to learn. And I always think as an MP that you're here to learn from people who are on the front line, who are working, who know what the challenges are, and who can make the policy, the people who develop policy, those of us who are in Parliament, make us aware of the challenges, because we have to get the correct policies in place to ensure that we have a fair and equal society in every realm. And it's certainly something through the All-Party Parliamentary Group for Disability and as Vice Chair of the Entrepreneurship APPG that I will continue to champion. I have had questions in Parliament in relation to this, and most recently with Secretary of State for Business. So I will be having meetings pending when we're allowed to meet again after the pandemic is appropriately addressed and restrictions are lifted at the correct time. So today for me is about being here with fantastically inspirational people, joining of the APPGs, and creating that momentum to move forward and look at the policy areas that we need to develop, to hearing your stories and ideas, the challenges that you've faced, and also how we can make sure that we put in place correct policies to harness everyone's potential. I've been looking forward to this all week, and I can't wait to get started in terms of listening to your experiences and learning how best to set the road ahead. So please feel that you have support through the All-Party Parliamentary Group system, and thank you once again to the APPG Secretariat for setting this up, and thank you again, and you'll hear from me again later on, I'm sure, and have some difficult questions. So thank you for asking me to come along today and speak.
Thank you so much, Lisa. And thank you very much for joining us. It's a pleasure to have your input. Right, we're now going to move on to Liz Johnson. So Liz, if you could tell us a bit about your experiences and your perspective on this important topic.
Hi everybody, thank you so much for having me today. It's great that it is Global Accessibility Awareness Day, but my biggest drum that I beat is that it shouldn't be a day, it should be a theme for everybody's life, because essentially it's accessibility that prevents everything and anything from happening. And this idea that actually accessibility is an option or a choice that people should buy into really, really grinds me and frustrates me. And so it's great to have people like Lisa championing the cause and helping push policies through, because whilst you don't want things to necessarily be driven by policies, sometimes they are necessary to underwrite things and ensure that they happen. And as Katrina mentioned in the intro, we launched the podium platform this morning, and essentially the reason we did that is because actually I hope that in this pandemic and everybody's change of circumstances, there's been an increased level of empathy, but also acceptance for the fact that there are a number of ways to do things, and people have choice, and people should be enabled to remove as many barriers as possible to make that happen. So that's my passion. I mean, I was fortunate enough, as also Katrina said, to be a Paralympic swimmer and win a gold medal, which was an added bonus, but it was way back in Beijing in 2008. So that is a former life. And I do not resemble that athlete very much to look at anymore. But I think very much, I'm very fortunate that I'm British. I love the support that we have. But I think from a clinical aspect, we're very well supported. But so often what we don't realize is that there needs to be a crossover, and accessibility needs to be the theme within everything. And without accessibility for all being part of any policy or any new initiative or any drive, then I really struggle to see how things get signed off. Because I think that's going to be the good and the bad to come out of the pandemic. I mean, like, as I've touched upon the good already, people are now more aware of what is possible and how easy it is. I think the frustrating thing is how easy it was when it suited the majority and it had an economical drive that people could relate to. When there's people with a need for this accessible way of working, that have been asking for it, requesting for it, crying out for it for decades, and nothing happened. And then all of a sudden, when it was necessary for everybody, it became normal very, very quickly. And I think that, for me and for the population and the demographic of disabled people, but also anybody else who has a need to do things differently, it's very, very frustrating. And I think that's the number one thing that we can all take out of this in a positive way, is possibilities are endless, and enabling people, actually, you reach a whole level of potential that you didn't realize existed, and we are stronger together. But I think, and that's what I want to move forward, and that's what I constantly talk about, is actually think of everybody when you're making changes, because so often a knee-jerk reaction is done, again, to serve the majority. But let's just take the initial reaction to the way that people access the supermarket, right? There was a list of vulnerable conditions, and what you deem to be vulnerable in a particular environment or a particular situation doesn't mean that everybody who was vulnerable in some sense before is now not vulnerable anymore. And so actually what happened was to include people who were directly infected by COVID-19, actually people who are directly affected by life often and the way it runs generally, then all of a sudden were worse off than they were before. And off, like, in terms of, and like, when I think of that, I don't think of myself. I have cerebral palsy, I'm hemiplegic, so physically impaired. And so often I am ambulant, but my mobility is poor. And so often people judge that based on, well, should you be a wheelchair user? And I'm like, well, I would go around in circles if I used a wheelchair, because I've only got one functioning arm, so that wouldn't be very practical. So a mobility aid that I use I like it. It's cool. It's like a bike without pedals, sort of a scooter, but not a big clumpy scooter. And the amount of times that I get stopped in places because it is not your conventional mobility aid is I've lost count, but also because I don't look like I should need a mobility scooter. And it's really, really frustrating, because actually I wouldn't be able to access things otherwise, especially in London. And so it's great that the government has initiatives, and it's great that they're reactive to things to try and help. But until we address accessibility as a whole and know that it's an underlying factor in everything that we do, then people are always going to miss out, or people are always going to be limited in reaching their potential. And I think that's the thing we need to remember now when we come out of the pandemic, is that actually, like, for example, when we talk about when we're allowed back out, people wearing masks to keep safe. Well, anybody who's hearing impaired is not going to be able to read people's lips, and therefore not going to be able to communicate, and all of a sudden they have been excluded further. So again, it's just having that cross consultation at every point. Because in Manchester, and I used to live in Manchester, I love Manchester, and I know that they've just been pedestrianising Deansgate, which is one of the main shopping streets. Because one of the great things to come out of the pandemic, and the fact that people haven't been going out, is there's less cars on the road, and obviously pollution is lower, and you can move around more freely when you are out on your exercise. So they pedestrianise it, great. But when they put in the bollards, they didn't think about the different forms of activity and mobility aids that you can use to be mobile in a physical fitness environment. And so the negative impact of that, of not being able to use your trike or your larger wheelchair or whatever, means that actually then the mental health impact on that is even worse, because again, you've been overlooked or not considered. And it's unfortunate, it's upsetting, and it's just frustrating. And so I think what we need, and what I've learned, is I was very fortunate to be a swimmer, but the Paralympic movement wasn't always what it is now. And when you talk about the Paralympics now, you know that the athletes are elite athletes who happen to have a disability. But 25 years ago, if you said you're a Paralympian, people, first of all, didn't know what it was. And secondly, were just grateful that I could swim without drowning. And I didn't go round in circles when I was swimming. And so I think we've been on that education process in sport, and so we can transfer that to every aspect of life. But we have to, I guess, push and work with people to constantly make sure that accessibility is the underlying factor to everything, and people are included in consultation at every level, because you can't be expected to fix things for people if you don't know what's wrong with them. So it's just having that broader perspective, I think, for me, makes a massive difference, in the sense that we have disabilities. I have a disability. I'm fine with it. I don't wish I was able-bodied. I don't wish I was any differently. I've lived my life like this, and I'm fortunate in many respects that I had my disability from birth, so I don't know what I'm missing out on, or how differently people would treat me if I didn't have my impairment. But what I do know is there's nothing that I can't do if I find a way around it, or if I'm given a fair opportunity to succeed. The problem is that society places so many barriers on us all, because we have to do things in a certain way, that becomes the limiting factor. So I would say that the support we need as people with disabilities is a fair and equitable opportunity to experience, ultimately, and people to appreciate that everybody is different, but that's okay, and that is not a weakness, and there's no need for pity, and there's definitely no need to feel shameful about who you are. But we all need to know that there's a range of different ways that we can access things. And I think I sometimes feel like I talk about it too much, but for me, authentic inclusion and normalizing people's differences is what's going to make the world move forward, and what's going to support people with disabilities to use their entrepreneurial skills and opportunities, but also just to give everybody a fair go, and every person with a disability the opportunity and the right to access any area that they want. Because ultimately, the reason so many people with disabilities become entrepreneurs is because they can't find a role or a job or a place in society that is either acceptant of the way they do things, or enables them to have a full life. It just becomes all about work because that's all they've got the energy for. So I think I've talked to you enough, but thank you very much.
Great. Great. I'll introduce Kush because I can see that Katrina. Yeah. So Kush will speak next, and then I think we'll hear from Lisa, and then we'll open it up to questions. So over to you, Kush.
Thank you for inviting me. It's a great honor to be here. The COVID-19 disease is not the great leveler, but disproportionately impacts the elderly, BAME communities, and disabled people in our society. In 2019, the Social Metrics Commission report confirmed that disability is one of the strongest predictors of being in poverty, with nearly half of all those living below the breadline living in a household where someone is disabled. Disabled people being twice as more likely to be unemployed than non-disabled people. We therefore need to focus upon systems change to combat the increasing inequality that will result from the pandemic in the UK. We live in an interdependent society, and we need to stop thinking about our industries as being separate and siloed. Health and transport are the perfect examples of this. If disabled people cannot access and manage their health because public spaces and services are inaccessible, then this will impact upon our ability to access education, employment, and to work effectively as entrepreneurs. One such example of systems change was my #NoWheelchairTax campaign that was implemented into law last month in England. This helped 2.5 million disabled people access critical health care in England by abolishing all disabled car parking charges in 206 NHS trusts in England and aligning the NHS in the UK. This was achieved by being published in The Times, The Daily Mail, The Telegraph, Disability News Service, and being interviewed with BBC London Radio. We worked with MPs from all the main political parties, resulting in us being in the manifestos of Labour, the Conservatives, and receiving formal support from the Liberal Democrats before the general election last year. It's very concerning that recently I've heard from multiple disabled people that there are still NHS trusts in Birmingham, Solihull, in the Yorkshire area that are still charging for disabled parking. In a post-COVID world, this is totally unacceptable. After this success, I expanded upon the campaign to create a standardized and compassionate disabled parking policy for councils in England. One of my main concerns was that NHS hospitals in big cities like London would not suddenly have larger car parks. There would be a supply and demand issue. London is an overly complex system for disabled people to navigate. We have 33 London boroughs, all having their own disabled parking policy. A lot of the parking meters don't even state their disabled parking policy. So one is dependent upon having a smartphone and accessing websites that may or may not even be accessible. My call for London was that the inner London boroughs would all provide a minimum of 4 hours free disabled parking, which is the same as the statutory target for NHS A&E waiting times, and also a lot of disabled parking bays, and the outer London boroughs would be free. This would enable churn in the system and optimize capacity utilization in the areas with the greatest demand. Currently, I got as far as getting the Royal Borough of Kensington and Chelsea, who strangely enough actually published their consultation paper today. This change in 3 wards of 3 of the leading hospitals in the UK, Chelsea, Westminster, the Royal Brompton and the Royal Marsden Hospital. Then I was targeting the prospective mayoral candidates rather than trying to work through all 33 London boroughs, as the elections have now been postponed due to COVID-19. Our public transport capacity has currently been reduced by 9/10 due to social distancing, and with disabled people at being greater risk of contracting the disease due to long-term conditions and increased probability of comorbidities, having accessible healthcare and transport systems are only going to be ever more critical for disabled people in our post-COVID world. Another key issue for disabled entrepreneurs is inaccessible offices. In London, only 25% of our tube stations are accessible. I raised this issue when I presented at the Disabled Entrepreneurs Roundtable and the Diverse Entrepreneurs Summit at the Greater London Authority. Fortunately, they listened to my recommendations and created the East London Inclusive Enterprise Zone, which is the first fully accessible, specifically designed space for entrepreneurs and business leaders who are disabled or who are focusing on serving disabled people at the end of last year. However, having just one hub is not going to be enough for disabled entrepreneurs in London, and we will need additional hubs in other parts of London and other major cities in the UK. The main government support for disabled entrepreneurs is Access to Work. Access to Work is a publicly funded employment support program which aims to help disabled people start or stay in work and is also accessible to disabled entrepreneurs. However, most are unable to access this due to the lower earnings limit, which is currently approximately 6,000 turnover. Due to COVID-19, my recommendation is to scrap this threshold for all disabled entrepreneurs who have ever had any turnover for this financial year and for all disabled entrepreneurs in their first year of business. The government has an ambition for an additional 1 million disabled people into work by 2027. Before lockdown began, employment had hit a record high, but April saw a 69% rise alone in unemployment, soaring 856,500 in just April, with around 8 million people so far who have been furloughed and a potential of 6 million finding themselves unemployed in the next 3 to 6 months, with furlough support being scaled back from August to October and rates of disability between 15 and 20%. We are now probably looking at an additional 1 million disabled people being unemployed by the end of 2020 if current trends continue. The single biggest barrier to disabled entrepreneurship is the climate of fear that has been generated after 10 years of austerity in the UK. I am currently working with Kaleidoscope Investments, an organization that invests in disabled entrepreneurs with great ideas and helps them to start their own business. We have spoken with over 1,000 disabled entrepreneurs over the past 5 years, and the single biggest comment that we receive is being afraid of losing benefits. The new enterprise allowance, which is meant to help job seekers start or develop their own business, is unfortunately a failure, as most disabled entrepreneurs don't tell the government that they are starting a new business, as they are worried about losing benefits. We need to focus and enable an environment where disabled entrepreneurs feel confident and not afraid to take the additional risks that are associated with starting a new business. I recommend a 2-year transition program where disabled entrepreneurs are guaranteed the same level of income as they would receive on benefits, and any profits generated are offset against this amount. A support package which could include 2 years free broadband, business banking services, MS Office subscription, and free access to accessible offices or hot desking facilities in the local area. Then rather than them coming to the job centre on a bi-weekly basis, they can focus on their new business. To prevent any risk of fraud and abuse, they could go on a quarterly basis where they could be measured against some basic new business starter metrics to check there is progression upon being an entrepreneur, i.e. after 3 months, a business idea and business plan, after 6 months, a website. For many disabled people, traditional employment may not be the most accessible or appropriate form of career. I have found entrepreneurship to be more accessible and flexible, where I have been able to focus upon my passion and values. I believe another key change in our post-COVID world, alongside digitization and working from home, is a lot more people are finally going to follow their passions and values through entrepreneurship rather than traditional employment. Thank you.
Great. We'll open it up to Q&A. I guess after a kind of quick response, I suppose, from Lisa to some of the ideas there, and then we'll get kind of cracking with the Q&A, if that's okay with you, Lisa. I think can you unmute?
There we are.
There we go. Got there.
Excellent. Yeah, I mean, one of the things that came up on the chat there that I was really interested in was how we take forward the APPGs and can we also utilise them in our APPGs so that people who maybe find it more difficult to get to Parliament, and of course the House of Commons itself is very inaccessible in so many ways, are able to participate. And I think that's a fantastic idea that I'll certainly be taking forward, and should be something that we can progress with relatively quickly. I think given that we're doing it already via parliamentary groups during the pandemic. Lots of issues there that we can take forward. I'm interested in looking at access to work and how to continue to make that supportive for people. The idea of the East London Inclusive Enterprise Zone, why that can't be something that's rolled out right across the United Kingdom and it's not just in London that we have accessibility, which seems to be the key component of the contributions that we've had so far, but we have that right across the United Kingdom, and that's a given rather than something that happens in one area. That we think about loans, and I've been speaking to banks through the APPG disability, and also I raised it with the Chancellor in relation to the barriers that are sometimes faced for people with disabilities in accessing finance. I think that's a key area to take forward too, and given that we need to look at the positives as well, I think I'd be really keen to also look at mentoring, because I know from the other work that I've done with the APPG entrepreneurship that's been so key and vital for many people who have felt there are so many challenges, or that they don't fit in, or naturally to entrepreneurship. That mentoring seems to be something that's extremely valuable and can open some of those doors and overcome some of those challenges. So I will take a big list as well from the meeting, and I'm sure there'll be many questions about what more we can do in relation to policy. I'll be taking a list of those, and I'm going to put it together so that we have a key understanding of the challenges and the policy asks. And if people can let me know as well about what are the difficulties with startup, what about scale up, is it easy to get mentorship and to make contacts in the business world currently. Those types of issues I think are all important, and I look forward to contributing and trying to coordinate and pull some things together for the APPGs going forward. Thank you.
Awesome. I think your list is about to get a lot longer as well after the questions,
I'm
so
sure.
you can see what's coming up. So we're going to try and coordinate people asking questions with Katrina. So I think the first one will go to Mark Heather, if we can make that work.
Okay. Yeah, I think I'm unmuted. So thanks, Lisa. You already talked about that. What I put in the chat as well. One of the reasons I put that in is last year and the year before, I did attend some of the APPG disability meetings, and I only live in Kent, and it was because of the traffic, because of other and getting in and out of Parliament, all those kind of things. It was 9 hours. It took me it was a 9 hour round trip just for a 1 hour meeting. And it was horrific, absolutely horrific. And of course, the problems is that also, you know, the fact that it's supposed to be for a disability meeting, it's usually late in the day, very late in the day as well, sort of 6-7 p.m. And it's just too late, but it doesn't need to be too early either. But there needs to be much more. So yes, it would be great just, you know, to explore this kind of platform. The other kind of stuff was that I generally, and this is generally not across the board, but a lot of the support that the disabled people get are from able-bodied people, or setups from able-bodied people, and they don't actually recognise the whole need that we have. I'm a wheelchair user as well, and I was listening in when Liz was speaking, and Kush with other things, but some of the problems I've had is even just accessing little parks and stuff where they've put, you know, frames up and all kinds of stuff. But I've gone through so many different platforms of trying to start something up, but had very little support, and I've seen that other people have put that in there. And the other thing about college and universities, I've got hidden disabilities too. I've got autism and ADHD, and the lack of support was very off-putting. In fact, I was doing a counselling, 4-year counselling course, and in the end I had to leave because they could not understand why I needed extra support. And again, this kind of stuff would have been really useful. And I'm absolutely frustrated, along with what Liz was talking, when we moved from the COVID response into the practicalities of everyday working lives. You know, it seemed to just happen almost like overnight that this was here. It was available for average able-bodied people. Yet disabled communities have been asking for this kind of all of this support for years, and suddenly it wasn't available before then. But now, you know, it was there. It was available straight away. And the same with all the things. I've been discriminated by employers. I've taken employers to tribunal, and then I've been told that I could not even be employed by that employer now because I took them to tribunal, you know. And it's just, and it was because it was a disability issue. It's indirect discrimination, which again is another one that we face. If I put anything on an application form, it's there.
Excellent. There's a lot there. Lisa, did you want to pick up on some of that? And also it'd be good to hear from Liz and Kush on some of the issues around how we make kind of these changes happen as well. So yeah, Lisa.
Oh no, I don't want to know. I've taken some notes.
Lisa, you're a bit quiet. Could you possibly?
Not used to quiet. Yeah, I'll catch up, and I've taken some notes on those issues. Certainly the APPG, I think we need to make it much more technologically savvy going forward, to include as many people as possible. And for people who do attend in person, then we will look at the timing again. It's difficult because sometimes there's questions and things during the day, which means that the MPs can come during the day. But if daytime suits better for people with disabilities to attend, I think that should be our primary purpose and consideration.
It was disconcerting. I mentioned it to the secretary at the time, and there was a lot of disabled people that were saying the same thing about the timing problems, but it was based around, oh well, it's not about your need, it's about the MP's needs. So yeah.
I've had some discussion with the speaker on that, and actually even some of the rooms we've had up in committee corridor haven't been accessible either. So we are looking at, you know, taking those issues forward, and the new speaker is very aware of them. So I'll add that onto the list.
Absolutely, and I think, yeah, just answering it from the APPG for entrepreneurship, I think this shows, although I think we've got stuff to learn in terms of sign language and having subtitles as well, I think it shows the value of technology potentially here. And kind of following up on that, I'd like to kind of ask that, kind of using some of the stuff there you said in terms of Liz and Kush, how optimistic are you that the technology that we're seeing now, and as you said, the response that's happening because of wider selection population being kind of impacted by this, that there's going to be some kind of positive change to come out of coronavirus, and that we'll see some good stuff for disabled people more broadly? So Liz, I'll ask you first, and then Kush, please.
I think there's got to be a balance, and I think that's what people have got to use when they measure it, because yes, it's shown what's possible, and it will open a whole new load of doors for people to have that opportunity. But there will be people who have found working from home extremely difficult and challenging. And especially, like, I've got a lot of friends who are neither have been furloughed, so they're both working full time from home, but they've got children or a toddler that they are trying to also entertain. And so for them, they cannot wait to get back into the office, because actually it's proving very, very impractical. So I think the key on the transition back out of this is how we frame it and how we educate it and everybody around the choices and the differences that are born out of necessity and choice, and actually saying that, yes, okay, it wasn't great for you, but there are people who actually, if they implement these strategies, their productivity will be so much more, and the opportunities become endless. So I think it's not a case of, exactly like I was saying earlier, we so often look for a fix, or a one size fits all, or oh, that works, so we'll all do it. Like, similarly, we can't all of a sudden decide that working from home was really good, so let's close offices because no one needs them. Because some people need to be with other people, but for our mental health, for everything, you just need a change of environment. I mean, I've been moving around the house just to work from different rooms so that I don't drive myself crazy. So there's very much, we need this balanced approach, and everything needs context, I think, with whatever we're doing. And just to touch on the point of the timing of meetings, again, it's exactly that, but it's not a case of just moving it to the morning or moving it to lunchtime, because then what happens is you get a whole section of the demographic who have disabilities that maybe are in 9 to 5 jobs that go, well, what's the assumption that everybody with a disability isn't at work? So, like, the point is, and like I know I harped on about it when I was talking to you all about the accessibility, and it's about that authentic inclusion and having different ways for people to access things, and then them having a choice, rather than it being placed upon you or directed at you, because it's the 21st century and it's 2020, though I think most people would rather us fast forward to 2021 straight away. But the point is, like, we are all human beings, and actually we no longer come up with strategies or come up with policies or build buildings and say, well, actually only men can enter right now, we're trying to work out when females can go in. Like, if it was any other demographic of minority other than people with disabilities, there would be uproar that there wasn't that parity of opportunity and an equitable experience for all. And so I think for me, that's going to be the key now. There are so many positives to take from this, so many, but like with anything, unless they are harboured and given context, and as Kush said, we need to remove the fear from, because people don't like change, people don't like not knowing things, and the fear comes from making a mistake or saying the wrong things or offending somebody unintentionally. And so we almost need to address that fear from people and make them understand that difference is okay and differences are positive. And I, for one, I don't need your sympathy, and I don't need your pity, and I don't even need you to give me an unfair advantage. I just need you to give me an equitable opportunity.
Great. Kush, did you have anything to add to that in response to the kind of issue around the kind of societal changes we'd like to see out of COVID?
Sure. So I think one of the key benefits for me in some way from COVID-19 was suddenly the whole of society became disabled. Like everybody suddenly became scared of leaving their house. Welcome to the life of a disabled person. Everybody became worried about accessing basic services. Welcome to the life of a disabled person. So suddenly things that were for a minority of the population suddenly became an issue for everybody. And hopefully one of the key transitions that I want to see in a post-COVID world, that disability no longer sits within diversity and inclusion, within organizations, but is actually a part of sustainability, is actually a part of corporate strategy, values, and ethics of all organizations. All organizations right now are going to be doing physical access audits in relation to social distancing. All organizations should be doing accessibility audits anyway in relation to, say, NRAC, National Register of Access Consultants. Hopefully now all organizations will start doing virtual audits. You could look at the website Contents Accessibility Guidance 2.1 level AA. And the truth is that actually EU legislation has actually been converted into UK law. And from September this year, we have the public sector bodies accessibility regulations that go into law. So all existing websites do need to be made accessible, but I'm not sure if all the councils, all the hospitals know about this, but this is a really significant law change that is happening. And it's really critical because the truth is, if disabled people can't access virtual environments, then, we're much less likely to go in physical environments. And one thing that COVID has shown that the virtual environments are just as important as the physical environments. And the third thing that I would add is the disability mantra is nothing about us without us. And this is really critical. So I think it's great that the disability unit has moved now from DWP into the Cabinet Office. But when I hear that they're creating, a strategy and a policy and not really including disabled people's organizations, and that disabled voice isn't really there, I worry how effective it's going to be. And my advice is the same to organizations. You have disabled employees. We have disabled entrepreneurs. Let's start listening to the voice of disabled people to actually shape and formulate policy going forward. Because that's the only way it's going to be right. Thanks.
Great, that's excellent. We're going to try and get through quite a few questions now as well. So I think we're going to go over to Max Fischel.
Yeah. Thanks very much. Yes, it follows on actually from what Kush was just saying there. My point was about representation at policy making level. And what that will do is if you have people with disabilities who are actively involved and have a yes-no say in policy making, what that will do is embed accessibility into every single policy decision, because it won't become a sudden add-on that somebody suddenly thinks of. My experience was mainly in mainstream schools in Kent, actually, working with students with physical disabilities and trying to get schools to understand the idea of accessibility. We have the SEND Code of Practice, we have the Equality Act, the Public Sector Equality Duty, and all these pieces of legislation. But every single school I went into, there were some aspects which were simply ignored or not known about, even though all the teachers were constantly going to training sessions. None of this was actually happening to any great degree. So, and of course, nobody in the school management board team was a person with a disability almost entirely all the time. So these issues simply didn't occur to people. Whereas if you have people with disabilities making these decisions, then it will become embedded. So one thing that people could actually do when they're making policy decisions and trying to come up with a solution to an issue is to have a routine question they always ask about their decision, which is simply, how does our decision affect accessibility for people who need reasonable adjustments? And for Lisa, I wondered how this might be addressed on a political level, so that you would have government departments actually having representation at policy making level.
Really good question. Lisa, over to you.
I think that's really important, and I think that obviously government should be consulted. And I'm not a member of the government, so I'm not here to speak exactly for the government. But you know, in terms of all parties should be developing their policies in conjunction with stakeholders, and you know, a massive stakeholder is people with disabilities. In terms of Parliament, I have been doing some work with the APPG over the past few years, and we've now developed our speakers internship scheme, where we're aware that so many people with disabilities are also excluded in many ways from even coming into Parliament, being elected representatives themselves, because of the massive challenges that people face in addition to what you usually face in terms of being elected. So what we're doing is we have this internship programme where there are places that are funded each year now, and there's the opportunity to have a placement for 10 months of the year with all of the different parties are included, and the speakers programme funds that. So we're trying to roll that out so that it's also going to be possible for MPs to do this within their constituency, because it's tended to be London-based so far, and the speaker's also very keen that we take this out on an international basis too, so that other countries also have a similar disability internship programme, and that we're saying, well, yes, we want people with disabilities to create policies, but we need to have you in Parliament to do that as well as being stakeholders, and I think that's really fundamental too.
Great. We have a question from Sharon. Can we? See if that works.
Hi, yeah, thank you for that, and hello everybody. Right, I'm a disabled entrepreneur, and I found it extremely difficult to find any help, grant or support until I was introduced to universal inclusion. I find that general business advice does not meet my needs with being disabled. Also, the only practical support is access to work, which in my opinion is in the wrong department. They've tend to have put it in with DWP instead of its own unit like it used to be. How will the government support existence as network of disabled entrepreneurs and ensure our needs are listened to and met?
Great. Do you want to answer that, Kush? Because I think that would certainly be one from your opening speech. You have something to.
It's to Lisa as well, please.
And to Lisa as well, obviously. Yes.
You want to go first? Lisa?
Kush, do you want to go first, and then Lisa, or vice?
I'm happy for Lisa to go first.
Go for it, Lisa.
Oh.
On the spot.
This is going to go first. Well, I mean, I think that you've hit the nail on the head in terms of general business advice. The general business advice often isn't accessible, but also it's not been adapted to include people's needs who maybe have other needs in terms of the usual ones that banks probably deal with every day, or that the enterprise centres deal with. So that's something that should be taken forward in terms of that they have to have inclusive policies, and they have to have advice giving services that are representative of the whole population. So I think that that's something that we can take forward. In terms of going forward with access to work, I'm really keen to get a list of the issues with that just now, and so that I can take it back, because I have a meeting every 5 weeks with the Disabilities Minister, so it's something that I continually press upon Justin Tomlinson when I meet with him. So if I can get some more details about the issues that people are facing, I'll certainly take that forward.
I think access to work is a really critical issue, because from my understanding currently, the disabled people that are using it are traditionally in traditional employment. Lots of disabled entrepreneurs don't even know they can access it. And currently, for the fact of the lower earnings limit, if you look at 9K turnover, like it's ridiculous that, you know, for most entrepreneurs, they're not going to get, 6K turnover. They're not going to get 6K turnover in their first year. So basically what that limit is saying, that if you're a disabled entrepreneur, you're not going to be able to access to work. You're not going to be able to have accessible technology solutions to help you to be an entrepreneur in your first year of work. Hence, it's probably going to jeopardize the whole viability of your enterprise. But to me, that's really illogical. There should be, you know, a caveat saying that all disabled entrepreneurs in their first year, it's scrapped that limit. And also post-COVID for this year, I've spoken to disabled entrepreneurs that have met the limit in previous years, and they're saying due to post-COVID circumstances this year, they're not going to have that turnover. And if we're saying that due to them not having that turnover this year, they can't access to work and have accessible solutions, then that's going to add additional barriers. So to me, actually, that should be scrapped for all disabled entrepreneurs who have ever had any turnover for this year in relation to specific targeted support for disabled entrepreneurs. And let's be completely honest, there is no support for disabled entrepreneurs. Disabled entrepreneurship seems to be the missing aspect of support in government in our post-COVID world. And this needs to be rectified, because the current trends, my analysis is that we're going to have an additional 1 million disabled people unemployed. Entrepreneurship is going to be a much more conducive conduit to employment for a lot of disabled people. And if we're not enabling that access and support, then the situation is going to get much worse very, very quickly, unfortunately.
Great answer. Can we go to 2 questions at once, just to kind of squeeze in before the end, and then we'll go across the panel and see kind of which is most pertinent to you. So got Chris and Philip. So should we go to Chris first and then to Philip?
Good afternoon. Thank you. I just want to raise a point that it may have been already covered. And trying to find initial funding, when I set up our charity Mending the Gap, I had to push through all the local fundings, and that not many wanted to help. So it's through sheer hard work. I only come across, dare I say, Lush's help me raise money, which has helped us progress with our charity. So there needs to be more help for initial fundings for people that, for disabled people like us, to get the ball rolling, etc. Does that make sense?
Yeah, great question. Yeah. Next one. So Philip Connolly.
Okay, thank you. First of all, I'd like to highlight what's happened to disabled people in the coronavirus crisis. People may not be aware that 9 out of 10 of the people dying are disabled people.
Yeah.
When they talk about people having an underlying health condition, and you go and look at the World Health Organization's categories of an underlying health condition, it becomes apparent that you could just as easily put the words disabling health disabling health condition as underlying health condition. So 9 out of the 10 of the people dying are disabled people. Secondly, almost all the people in the Shield group are disabled people. Thirdly, the people recovering from coronavirus, particularly if they've had medical treatment, are at least temporarily disabled. And then, of course, if the NHS are doing an important job, which of course they are, then the people that they're caring for must be important people. And they're disabled people. So this is a crisis of disabled people. But the wonderful thing is, in some respects, that there's an opportunity now to remake the economy. Huge swathes of industry and commerce are now coming to the government for a bailout. It should be a quid pro quo on that bailout, that they make their own industries and commerce and businesses accessible and inclusive in their employment and employment needs, and similarly in training. Great. Everybody here has an MP. Every MP should have an influence on the economic recovery plan. We must now get to work on that economic recovery plan. It's our opportunity. This crisis is about us, and we must get to work on that plan. We must influence it in the interests of all of us. Thank you very much.
Great. There are two really good questions there. So one on finding funding, and the other on both, I suppose, the health response and also the economic response. So in a very short time, it'd be good to kind of hear from you all. So we'll start with Liz, then Kush, then Lisa, and then we'll call it a day. So over to you, Liz.
So yeah, just to wrap up quickly, I think both points, again, to harp on about it, but if we look at that cross communication between all departments, and whenever we're looking at designing processes or policies or applications or anything like that, we need to make sure that they are fully accessible, and it isn't a case of a one size fits all or a certain box. And I guess that's the issue with access to work often, and another such funding, as you mentioned, Chris, is that if you don't fit into a certain category or a certain way of operation, then you're not eligible. And like, again, one of the problems with access to works often is that they initially ask you for your contract and your hours of work. Well, if you're going to be an entrepreneur, you don't have a contract or hours of work initially, and you don't know what they're going to look like. But even in a more conventional environment, if they could split that a little bit so that the employer had the opportunity to access a portion of the Access to Work Fund, then those adaptations or adjustments that are made to the environment, they're not just for that one individual, Liz Johnson. Long after I've moved on, more and more people can benefit from that. Or because the adaptation has been made and Liz Johnson or someone else is working in that environment, you'll attract more people. And I know I saw a question that we haven't gotten to about attracting more people with disabilities to become employees. And it is all around making it accessible, making sure your message and your values align, because ultimately nobody with a disability wants their disability to be their defining factor and the reason people know who they are or give them an opportunity. People want to be able to access what they are capable of and what they have potential for. So we need to create a world where you normalize difference and you're not so stringent on your judgment processes, because people's perceptions and misconceptions of what is possible are what skew the entire system. And I hope that kind of underlies both, like an answer to both questions or points.
Excellent, very much so. Kush.
So if you're looking for funding and you're a disabled entrepreneur, I recommend you go to Kaleidoscope Investments or Kaleidoscope Group, because we invest in disabled entrepreneurs. We'll send the relevant links afterwards. So that's one thing that I definitely recommend. And the other thing that I like to focus upon is, rather than thinking of disability always in the terms of diversity, inclusion, or kind of ethics and values, let's actually start thinking about the purchasing power of the purple pound, which in the UK is 250 billion, because we have 15 to 20% of the population, equating to 14 million people being disabled. Globally, that's 1.3 billion people, and that globally equates to a purchasing power of $8 trillion. So we're talking about a huge business case in relation to disability. And I think there's been some great work in relation to this with Carolyn Casey and the Valuable 500 initiative. And the last thing I want to say is some of our greatest entrepreneurs are disabled. Look at Steve Jobs, dyslexia, bipolar. Look at Richard Branson, dyslexia. Look at Henry Ford. Look at Tommy Hilfiger. Look at Walt Disney. Some of our greatest ever entrepreneurs are disabled people. Thank you.
Fantastic. Guys,
Excellent. Finally to Lisa, just say the final words. Just before she does, I'll just say that obviously there's been so many questions, both before that we haven't been able to get to, and also from you guys. So we'll definitely see this as a trial event that's going to kind of hopefully lead to a lot more work in this space. And I'll send an email out to everyone, kind of following up and with some of the points that you guys have made to me, but also an opportunity for you to let me know more about what you're up to, and kind of then share that once again around the network. So that's the final you'll hear from me. So over to you, Lisa, and then Katrina can just round up.
Lisa?
I think I was muted. My husband's been trying to do that for some time. I think what I wanted to say was, in terms of funding, I've been raising that with banks, so it's an ongoing stream of work that we are progressing in Parliament in relation to in consultation with the banks. We've also written from the All-Party Disability Group, and it's had support of 101 MPs and peers now, a letter to the Prime Minister regarding the importance of a disability inclusive economic recovery plan from COVID. So please link in with that work that's being done. We're waiting on a response from the Prime Minister, but I raised it once again yesterday to the Leader of the House and last week to the Chancellor. I think this has been a fantastic session, but it could have gone on all afternoon actually, and we're only really scraping the surface of the issues that we need to deal with. So I can't speak for the APPG for entrepreneurship because I don't chair that one, but I think for the disability APPG, we would love to link with the entrepreneurship APPG in the future, perhaps maybe to look at an inquiry report round about entrepreneurship for people with disabilities, and we can have those discussions and see if we can if we have the capacity to take that forward. But I think that this discussion and policy making session really deserves much more time and much more involvement, and to look at the issues as they are. They're very detailed issues, to look at them properly. So I'd be very willing to take that forward, and I hope that people have benefited from today. I think it's the start of what we're going to be doing rather than a session in itself. So thank you so much for your contributions once again.
And thank you to you, Lisa, and to Liz and Kush. I think speaking for the APPG for Entrepreneurship, absolutely. I mean, this has been a completely fascinating conversation. Wonderful questions coming through. Thank you so much to everybody that submitted your thoughts and things that you wanted to expand on. And I definitely think this is the beginning of a wider conversation about how we can support disabled people in entrepreneurship, because entrepreneurship is going to become so important after COVID-19. We have to change the whole industry, and so so is disabled access, and indeed access for everybody. I really loved the bit where I think Kush, you said everyone's experienced being disabled in this time. We're going to wrap up there. Thank you so much for sticking with us. A few minutes over time, but that is just a testament to the conversation we've been having. We have a few more webinars coming up over the next few weeks, so please check them out on APPG. Entrepreneurship.org, and we'll be sending out an email with links to the various things that we've spoken about during this session. Please respond to that email with the questions you've asked. We're also going to save the chat that we've had during this time and share some of the questions with our speakers. Once again, thank you so much, Lisa, Liz, and Kush. Really, really grateful for your thoughts and you know, the really interesting perspectives you all bring. So thank you again. Guys, we're going to sign off there. Have a lovely afternoon. Silent clapping from the audience. Thank you very much. Have a lovely afternoon. Goodbye.